Welcome to the Rational Egoist. I'm your host, Michael Leibowitz. Normally on this show, I deal with topics ranging from philosophy and economics, politics, culture, criminal justice. But there's a topic that has special importance to me, and that's autism. And it never did before, but my girlfriend has an absolutely beautiful 4-year-old son who has been diagnosed on the spectrum. He's actually here with us today. He's off camera, but he may decide to pop in every now and then. But here today to explain to us a little about autism, I wanted her to come on to educate me so I would know how to deal with it better, so I could be better for him. And today it's Dr. Amy Marschall. She's a licensed clinical psychologist, certified in trauma-focused cognitive behavioral therapy and telemental health. And she works primarily with children and adolescents. Dr. Marschall, welcome to the show.
Thank you. It's good to be here.
He's very shy. He keeps coming over to peek. He'll be okay.
He can if he wants, I don't mind, but I also understand he's never met me before. I'm a stranger.
Yeah.
So
Want to sit up here? No. Okay. Okay.
I have cats that might also hop on and off.
All right. That's fine. Cats, kids, everything. Make it interesting. Yep. So I just recently read about a idea that I've never come across before called neurodivergence. Can you explain what that is?
So basically, neurodivergence, it's kind of a broad umbrella term, and there is some disagreement. Different people have slightly different definitions for it, but essentially it refers to people whose brain doesn't function the way that we would necessarily expect. Or the way we've kind of developed society to fit to, basically. So autism is one of many diagnoses that fall under that neurodivergence umbrella. Okay. Basically, autistic people perceive and interact with the world in a way that is not what a neurotypical expectation would be. And it also includes ADHD, dyslexia. Some definitions also include other mood disorders, depression, bipolar disorders, psychotic disorders, brain injuries, depending on how broad of a term. Personally, I'm very much an inclusionist on most things. So I say, if you have a brain difference that might make some things challenging for you, welcome.
So is neurodivergence kind of a matter of eliminating stigma and just recognizing that different doesn't mean wrong?
Yeah. Oh, yeah. That's a big part of it. Some of it is different doesn't mean wrong or bad or flawed or like shouldn't exist. Yeah. And it's also just acknowledging that when there are challenges that come with it, those challenges can be supported. And, for certain things, for example, I have ADHD and I'm autistic.
Really?
There are, so there are days like for me that when my sensory stuff, when I'm maybe a little bit more stressed out, my sensory sensitivities are more intense. I think I've posted on social media before, like, hey, I went to the grocery store and I had to turn around and leave without getting anything because the lights were too bright and it was too loud. And, that is, that's a disability. I can't go and do this thing that I'm just expected to be able to do as an adult. And there's also an argument to be made of, well, why is the grocery store so bright and loud? We could have dimmer lights at the grocery store, but there are some things that even if we tweaked society would still be more challenging. And so it's not that, it's not, disabled isn't a dirty word. So, it's acknowledging that when there are challenges, that doesn't devalue anyone's humanity, essentially.
It's interesting that you talked about the sensory stuff, because as everybody can hear, Vincenzo he likes sensory stimulation. So he right now has a little flagpole that he's running across things and he's banging on things.
Oh, Vincenzo, nice. Yeah.
Say hi. No,
it's kind of funny. You can be sensory. Oh, here's Armani. You can be sensory avoidant and sensory seeking at the same time. Hi.
And that's what it seems. So from what I've just read, people on the spectrum, the autism spectrum, what an adorable cat.
Sorry, this is Armani. He is my helper.
Oh, that is awesome.
He comes and goes when he feels like it.
So people, there's similarities and there's differences. So can you first tell us, like, what are the commonalities that all people with autism or all autistic people would share, and then what are some
Sure.
differences?
So there's an expression. If you've met one autistic person, you've met one autistic person. That
Yes.
it's very individualized, and everybody is a unique individual. There's certain traits. So, for example, many autistic people tend to respond differently to sensory kinds of things, and sometimes that's being more sensitive to it. Sometimes that's being less sensitive to it. Autistic people tend to communicate in a different way. The kind of mainstream image of that is the not picking up on social cues, but there's also a tendency to what we call hyper focus. So
Yeah.
when we're interested in something, we're, like it's 1,000%. I teach a graduate course at the program where I got my doctorate, and I've said to my students, I'm not diagnosing you all, but it takes a very specific type of person to write a dissertation and be able to focus on a topic that intensely and for that long, and finish the dissertation project. So for some people, actually, we call it a special interest when that's the thing that you're hyper focusing on. For some people, their special interest is other people, so they might learn a lot of those social cues just because they're so fascinated by the concept. There are, and I'm not diagnosing anyone, but there are several actors in Hollywood who are open that they've been diagnosed.
Yeah.
And there's kind of a thought of like, what kind of person just that deeply wants to learn another person and like act as another person. So something to be said for that, I think.
All my life, I thought of
Mhm.
autistic people as not being able to empathize with others, relate to others, but when I met Vinny,
Mhm.
he is one of the most empathetic people I've ever come across in my, like, I mean, just to give an example, I have a paper here that's got some of my talking points in front of me so I can see it. And I don't need him anymore. And he's been wanting to play with them. So I just took it and I threw it on the floor. And he
Mhm.
saw that and he walked over here. He picked it up and put it right back on the computer screen. And there's
Sure.
been times like if he sees his mother sad, he'll run over and say, "Don't sad, don't sad." I mean, the kid is just an absolute doll, but I never knew that about autistic people. I just thought that they are just distant socially, don't really identify with anybody, and that's it. I mean, I
And
guess that
yeah.
I guess
Mhm.
that goes to show you don't get your evidence about people from watching movies,
Right. Well,
from watching
that's the thing,
television.
is that, yeah, that's the stereotype. And honestly, like I was conducting autism evaluations before I was diagnosed.
Really?
And yeah, and I was conducting ADHD evaluations before I was diagnosed.
Wow.
And I'm looking back and I'm like, we've got this very specific and very narrow view of what autism is and what an autistic person acts like. And it makes a lot of people go under the radar. Empathy is it is kind of it's a complex topic. it's
Yeah.
it's your ability to like literally feel what other people are feeling, and some people, autistic or not, have varying degrees of empathy. Some people who are low empathy are still very loving. It's just a matter of they don't literally, so like, for example, if you started crying right now, I might feel your sadness from seeing you cry. If I were lower empathy, I might recognize you're sad and you're crying, and I might want you to feel better.
Vincenzo, enough.
But
Come here.
oh but I wouldn't be like
Sorry.
feeling your sadness along with you. But what we find too is that, yes, autistic people do fall on that empathy spectrum, just like people who aren't autistic. But for some of us, we don't experience as much of that literally feeling your emotions with you. But for others, we actually are on the kind of that opposite extreme, that you sometimes get. Well, first of all, when your social skills aren't neurotypical, you can be feeling empathy, but nobody realizes it because you're not expressing it on your face the way that they might expect you to. And we take that to mean that you're not experiencing it. But you can also get that that sensitivity to other people's emotions is so intense that you have to figure out how to shut it down. Otherwise, it just gets worse and worse. I nannied in graduate school, and I always think of this little girl that I used to nanny, and I don't know if she was autistic or not, but she was very high empathy, and there's a gnat in here, sorry. I was walking her to the bus stop, and there was a bird that had been run over, and this poor little girl just absolutely lost it, because
Oh,
she was like,
wow.
oh my God, the bird is dead. Did it hurt when it died? Does its family know that it died? Did it have babies who think that it just never came home? And I'm like, your capacity to care and your capacity to feel that is such a gift, but also like, we got to go right now. We need to be able to put that aside, because there's nothing we can do for this bird,
Yeah.
but you need to get on the bus. So there's kind of anything to an extreme is going to cause problems.
How can I distinguish? Because all 4-year-olds misbehave, right?
Yes.
So how do I distinguish between stuff that's relevant to the diagnosis and stuff that's just a 4-year-old? And do I even need to?
Yeah, and that's one of the things, especially with the autistic community, when we talk about neurotype kinds of things, it's a brain difference.
Yeah.
So there's a lot of people within the community that talk about that, and that's part of there's individual preferences. So always like do what individuals ask you to do, but there is a resource. It's called Autistic Not Weird, and the creator. I don't have his name at the front of my brain right now, but he did a very in-depth survey of the autistic community, and just basically was like, what are your opinions on all of these things that are relevant to our community? And he surveyed people who aren't autistic as well, but he took that in, like that was on the survey. So he teased it out, and he's like, here's what the autistic community, here's what this % of the autistic community says about this. And the one that he completed in 2022, 80% of autistic people, when asked about language, said that it's preferable to say autistic person instead of person with autism. So
Really?
identity first instead of person first. Mm-hmm.
Oh,
And I
wow.
mean, if I in my clinical practice encounter someone and they say, I would prefer you to refer to me as a person with autism, that's 1 in 5 of the community. That's not
Yeah.
nobody. But when I'm writing about it and things like that, I use the identity first, because that's what the majority's saying. But a lot of people who have expressed, which one do we go with, is when you're looking at something like autism, because it fundamentally changes how your brain works. Well, not changes, but it's a difference in how your brain works, in how you perceive other people, the world, in how you communicate, present yourself. They've kind of said, okay, so if I wasn't autistic, would I still be me, because it's so
Yeah.
fundamental in your brain? So as far as like diagnosis wise, with kids especially, it's less about what's coming from autism, what's not, but really just what are his needs, and the diagnosis informs his needs, because some of his needs might be different than a kid who's not autistic. But just figuring out what they are, and behavior communicates, especially with kids who don't have the language yet to communicate, but adults too. And so, what's this behavior communicating?
It's interesting you mentioned communication,
Mhm,
because he
mhm,
tried so hard to communicate, and,
sure. Mhm,
I'm trying to learn how to empathize, because
mhm,
he'll get very upset, and I'm just trying to, put myself in his position. If I were unable to communicate what I wanted, if my needs couldn't be met simply by
mhm.
saying, can will you do this for me, or can you get that for me? I'd probably scream too. You know what I
It's very
mean?
frustrating.
Yeah, I can imagine,
You don't get it.
Yeah. Um, Now, I read recently that autism is not considered a disease. Then why consider it a diagnosis? I don't understand the whole thing.
Yeah. So it's not a disease in that, well, first of all, it's not contagious. But it's also not, it's not something, again, different doesn't mean bad. Diagnosis wise, and I'm not the end all with, some of this is my opinion.
Mm-hmm.
And I have expertise, absolutely, but I'm not the we didn't hold a vote and I'm the voice of all the autistic people. But basically, because a lot of autistic people are disabled, and some of those disabilities are directly related to being autistic, like extreme sensory issues. If I can't go do the things that I need to do, the Americans with Disabilities Act has a list of, if you meet at least one of these categories, you're disabled. I'd have to look it up to remember what it is, but one of them is, can you independently just do all the things you need to do in a day without help? And if the answer is no, you're disabled. And for some, yes, a lot of there are other disabilities that are more likely when you're autistic, but there are also just things like the sensory kinds of things, or if your communication difficulties are such that you have not yet found a way to express what your needs are at all in a way that the people around you can figure it out. It would still be a disability in that sense. For some, and this varies so much, but some autistic people are never able to verbally say words with their mouth, and their entire life they can't do that. And so that's disabling, because if I'm out somewhere and I need help, I can't just say, oh,
Yeah.
hey, I need help. I can't just. And there are aids that are very helpful for that. There's AAC is the acronym, and I always forget what it stands for, but it's like, there's actually even phone apps that'll be like, you type it in and it reads out loud for you. There's, boards where you push the image of what you're trying to share and it like cues someone. And those are great, but you don't necessarily, if you're just like out in the world, a random stranger isn't going to know what you're trying to say. So, there's things, if it's related to that, can be disabling. And some people, there's varying degrees of being able to speak out loud. Oh, hi.
Come here. Come here.
You come to say hi?
Say hi, Dr. Marschall. Say hi.
If you're shy, I'm a stranger.
Say hi.
Hi.
Hey.
What's the name of the show, Vinny?
So,
What are we on right now? Welcome
to Rational Egoist.
He's a doll. Okay, here, go back down. All right. Now, something I wanted to know is, he is being exceptionally good right now.
Sure.
He really is. But there's times when he just throws belligerent tantrums, and especially in public, and people around don't understand what's happening. And it's
are
like
awful about that, by the way.
Yes,
sorry.
No, they are. And he's having a blast now.
Good.
But what's the best way to handle that? Because when that happens, like, he's not listening, he's just throwing a tantrum.
Yeah,
Now,
well, you can't. Yeah, you get to that point of, we call it meltdown, when you're at that overstimulation point, and it's like,
Okay.
I cannot handle this anymore. And ideally, the long-term goal is to help realize before you're at that meltdown flashpoint, and to be able to share, hey, I'm heading in this direction. And then, so like, if you're out in public, the ideal would be for him to be able to, hi, to be able to say, yeah, to be able to say, I'm getting close to my limit, and then the response being, all right, let's get you out of here, before it gets to that extreme. But sometimes we don't know that we're getting close to that. And some of that too is, when you exist in a world that's not built for how your brain works, you start masking, and you don't necessarily know that you're doing it. Hi.
Say hi.
Hi.
Say I'm Vinny. Now, when that happens, right? Is it okay? Because like, his mother, I feel so bad. Like, his mother's tiny. She's, 5 feet tall, 5'1", 90 pounds. He's a big kid. So,
Sure.
so she can't, when he's doing that, just pick him up and carry him off.
Sure. Right.
I can't.
We gotta just wait. We gotta
Yeah.
wait until it's
Well,
safe.
and that's what I'm wondering. Is it okay in those circumstances to pick?
Bye.
No, not goodbye. That's what he says when he's done with something and he wants to
Oh, I mean,
move
he
on.
can be done talking to me if he wants
can't.
to.
Well, no, what he means by, he means it's time
Oh.
for me to go.
Oh, he's like, you're done now.
Yes, so say all done, Michael. But is it okay in those circumstances? Like, is it harmful to him to just pick him up and remove him from the circumstances?
I mean, the goal in that moment is safety. And that's making sure that we're safe until the meltdown is done. And
Yeah.
so if we're, and depending on what his meltdown looks like some people will like whip their head around when they're in that state. And so if I'm on a concrete floor and I'm at risk of like smacking my head against the concrete, then yeah, you got to get me, where I can be safe until I've calmed down. Sometimes, I mean, depending on, and it's very individualized, that could even be more stimulating though, of like, now someone has hands on me. So it's just that, the number one priority is safety. And then the long-term goal of being, how do we know before it happens so that we can prevent it?
Are there any effective treatments that would, can minimize the disability or help facilitate, functioning?
Sure. And there are, we are lacking, especially for adults, supportive services. But basically the goal is to figure out that communication. Unfortunately, historically, a lot of like therapies for autism have been, how do we teach them how to mask? How do we teach them not to act so autistic? And that, I mean, it was successful in that a lot of these kids learned how to act like they're not autistic, but then eventually they hit a point where masking is exhausting.
Is masking basically it's suppression is what you're talking about,
masking
right?
is, I'm going to make you think I'm neurotypical. I'm going to act like I'm neurotypical. And I mean, we do all mask a certain amount. I'm private practice now, but back when I worked for an agency, I would joke, I don't talk to my boss the way that I talk to my husband.
You froze. You okay?
When I'm at work and I'm being professional, I'm right. But when the message is fundamentally like, oh, sorry.
You kind of froze.
Oh, I think I froze for a second. Can you still hear me?
I can hear you.
Oh,
Yeah.
Sorry. Am I back?
You're back. Yeah.
Oh, good. Okay. So when the message is, when the message is you're at work, you need to meet our standards of behavior while you're on the clock, then I can go home and relax. But when the message is you are wrong, the way that you are is wrong, you need to behave this way to be right, you never let the mask down. And eventually that leads to burnout, which we previously called regression, because the person would start acting autistic again, because they just literally don't have the capacity to maintain that long term.
Hold on. Vincenzo,
sure.
Come here. You can't go out there. Sorry.
That's okay.
He's getting a little rambunctious.
Sure.
now he's laughing.
Yeah.
I actually have read that waitresses, for instance, end up with a lot of psychological problems because of that very thing. And they're not on the spectrum, but not all.
Right.
But it's just the simple fact of having all day to suppress who you are leads to problems. So
it's exhausting.
Yeah. So I guess my question is the ideal therapy, it seems to me, and obviously you can tell me, if I'm onto something or if I'm wrong, but you'd want to be able to teach the person to function so that they could thrive to the best of their ability, but not pretend that there's something they aren't, or that there's something wrong with them that needs to be hidden from the world.
Right. And that's kind of what we call the neurodiversity affirming care, which is that recognition that you're not bad or wrong, but there might be some things that are hard for you. And how do we help you with those things, where we need to, I'm writing a book on this right now. So
excellent. I'm going to have
it's
to
not
buy
coming
it when it
till
comes
next
out.
year, but Yeah, it's next year sometime, but basically it's because, for example, stimming, so like a repetitive movement or saying a phrase over and over. I mean, there's a bunch
Okay,
of different
explain.
kinds.
I
Oh,
just
sure,
I just learned what stimming was the other
sure.
day, but I'm sure the
Yeah.
audience has no idea. What is
Yeah,
stimming?
so it's a repetition that helps someone regulate. It can also be just sensory wise, you enjoy that particular movement. It can look similar to fidgeting. Oh, actually, I've got an infinity cube right now.
Okay.
That I just, I've got a few on my desk that I can just grab and I can be like, okay, here's a movement that I just enjoy that makes me feel better when I'm doing it. So I'll do it. But basically it can look weird. So for example, I guess the one we see on TV is the hand flapping.
Yes.
And there's nothing wrong with hand flapping. If you feel
No.
good when you're flapping your hands, do it. But then people get teased and bullied. And so then we say, oh, they're being bullied for hand flapping. We need to make them stop hand flapping. Instead of they're being bullied for hand flapping, let's teach their peers to be kind
Yes, to be
and
more
let them do this
accepting.
thing. Right. Yeah. Just teach kids to not be jerks. And kids are good at learning that if adults take the time to teach them. But if your response to the kid being bullied is you should change who you are to stop being bullied, that first of all reinforces the bullying because see, I was right to not accept them as they were. And it teaches the child, even if they mask effectively and are never bullied again, it teaches the child, hey, they were right to ridicule who you really are because that was bad and wrong. And you shouldn't have been moving your hands that way. So, I mean, sometimes STEM behaviors can be not great. Like for some people, they'll stim by picking at their cuticles or picking at their skin, and I don't want you to injure yourself. Like that's but that's not that stimming is inherently bad. That's I care about you and want you to be safe. And so it's not telling them don't stim, it's telling them let's find something that meets whatever sensory need the skin picking is meeting without hurting your skin, basically.
See, to me, this little boy is so beautiful. The idea of
Oh, did I
him
freeze again?
pretending
Oh,
to
there we go.
be something that
Yeah.
he isn't or hiding his true self, that saddens me. But at the same time, I want him to be able to have a good life.
Right.
You know what I mean? So I guess it's like it must be a tough balance. But is it true that everybody stims, but just some people just don't pick up on the social cues telling them that they shouldn't do it, so they'll stop, whereas
That
autistic people
right.
don't pick that up and keep going?
I've heard that everybody does some kind of stimming, and I guess it depends on how broadly you're defining stimming. Because everybody moves. And everybody does repeat movements sometimes, and
Yeah.
everybody, one form of stimming could be I really like this song, so I'm going to play it on repeat over and over because hearing it over and over again is relaxing to me. And I think everyone, at least in our adolescence, I'm sure everyone did that at least once.
Sure. I used to have a habit where I would take my fingers and I would touch like this,
Yeah.
one to the next. And I guess that's a form of stimming,
Yeah, if
a
it,
way of
because
calming down.
the difference between stimming and fidgeting is I need to be moving. And so, if I'm fidgeting one particular way, I can fidget another, I can be wiggling around, whatever. Stimming is this movement is meeting a need in some way. So if this calms you down, that would be stimming. And if this is just, I'm in a meeting and I'm tired of being in this chair, then that would be the fidgeting. Yeah.
So first of all, let me ask you if you don't mind, what is because I would never have known it. If you didn't tell me that you were autistic, I would, Vincenzo, come here. I would never have guessed it. Like, so what is the biggest struggle that you face?
Sure. Well, and I mean, I am, I can communicate with words almost all of the time. I, got through a doctoral program. I've got a lot of, I'm not trying to sound braggy. I've got a lot going for
You
me as
don't.
far as resources to compensate.
And by
So,
the
you know,
way,
it doesn't.
bragging would be appropriate. You've accomplished a
Okay,
lot.
all
You
right.
should be proud of yourself.
I mean, I'm not better than someone who can't get through a doctoral program is my point, basically. I just happened, I've said this, it's, you know, it's not, my special interest happened to be in a field that was hiring. So it worked out, and that was nice. But you know, a lot of autistic people can't work full-time, or even sometimes can't work at all, because of the way that their needs are. They're not able to have like a 40-hour-a-week job. And I mean, you know, there's debates about the 40-hour work week anyway, which
Sure.
I have, you know, which I have some agreement with. But you know, I mean, for me, it also helps. I didn't realize how much masking I do when I leave my house until lockdown. I mean, I'm in South Dakota. We never technically had lockdown, but I'm married to a nurse, and he was on the COVID floor for 2 years. So we did our own self-imposed lockdown just because of that.
Yeah.
But I didn't realize how much I was masking until I was just at home for so long and I didn't have to. And then I went back to the office and I was like, whoa, you know, you don't realize it when it's so automatic. And so, and you know, over time it does wear you down. So I don't want to go back to doing that all the time. So I've been able to, you know, I am primarily telehealth. I do, you know, I'm in an office 1 day a week instead of every day. And you know, I love my husband. He's very helpful. You know, when we, you know, for example, we get you know, for the grocery store example, I hate the grocery store so much, but you know, we'll grocery shop together because he's like, why don't I just be the one who gets our groceries? And I'm like, well, I'm just, you know, I need my very specific food though. And what if, you know, because we actually had a communication difference, because I would go and the specific brand that he asked me for was sold out, so I wouldn't get it. And he's like, why didn't you just get a different brand? And I'm like, you didn't ask me to get that. And then he would pick up a different brand and I'd say, I can't eat this. This isn't what I told you to get. And so we realized there was a difference. He can't tell the difference between the different brands of yogurt. I can. And if it's not the one I asked for, then I don't want it. But so we grocery shop together because I want to make sure, you know, I can pick out my own substitutions. I know what my brain is going to be okay with. But, you know, sometimes I'll reach a point and I'll just be like, hey, I'm done being here. And he'll be like, all right, you wait in the car. And then he just like does the rest of it. So we still get our food. So that's been, it's good to have that kind of support.
I can imagine.
Mm-hmm.
Well, first I want to tell you something about me. I've never been diagnosed being on the spectrum, and I have no reason to really think I am, but I do have an issue where, and I don't really care. I don't notice things in my visual field. So for instance, you know, it's no secret to anybody, I was in prison for a long time, and I moved in with my friend, and he asked me, okay, what kind of pictures do you want up? And I said, yeah, I don't care. You know, it doesn't appeal to me. I don't. So he came and put pictures up, and he, oh, did you notice the picture? No, I didn't notice.
No.
You notice the picture outside? No. And I just don't. And I don't care that I don't notice. Doesn't bother me any. I'm not missing anything because I don't put any, you know, value on that. But is that something that autistic people, that type of thing, would be dealing with? Because somebody actually commented to me that's indicative of someone on the spectrum. That's why I'm asking.
Okay. Well, it's also, if you take really broad, you know, if you take broad enough, I'm not, I don't agree with the everyone's a little autistic statement. I don't think that's accurate. And that can actually, some people find that super invalidating. So I make a point not to say it. But if you take traits and you take a broad enough interpretation of traits, they will end up applying to everybody. There's a thing when we're in our graduate program, when we start learning the DSM, our professors are like, listen, you are about to think that you have every diagnosis in here, because you read it and you go in a broad sense and you're like, oh, you know, looking at ADHD, do you ever make careless mistakes? everybody does sometimes.
Yeah, of course.
But is it that, is it that difference, like, or is it just, nobody's perfect all the time? Social communication differences, there might be like, do you have miscommunications? Well, who's never had a miscommunication?
Yeah.
So if you go broad enough, it can be, but I mean, I'm not diagnosing you either, but you can fill out, there's some different measures. I think Embracing Autism is the website that has a few free measures that you can just fill out. And that's a big starting point for a lot of people of like, they see some things elevate and they're like, oh, hey, maybe I am, maybe this does, or maybe it doesn't. So, oh, you're muted.
I am. If you had to
Okay.
recommend one book
Mhm.
for someone to read if they really wanted to understand autism, what book would you recommend and why?
Sure. Oh, it's hard to say just one. I would more say, look for autistic authors writing about autism, because historically, again, it's always been people who aren't autistic writing about it. And it's been like, it's really traditionally is, how are you making a problem for people around you? And if you're not making a problem for people around you, you're fine. And that's why so many of us burned out and didn't get diagnosed until adulthood. But I mean, there are quite a few. I know that Unmasking Autism is a big one right now. Also, the Autistic Assessment Handbook. There's a few books with that title, but the one I'm thinking of, the cover has a gold infinity sign, which is the I guess I don't know how this was determined, but there's again a lot of talk within the community, the puzzle piece. Basically, that image for autism was developed by someone who's not autistic, and their rationale is autistic people have a puzzle piece missing. You're not complete because you're autistic, and so the puzzle piece represents what's missing from you. So the community has taken the infinity symbol to represent autism instead. And specifically, the gold infinity symbol is autism. There's also a rainbow infinity symbol that's neurodivergent, or it's either neurodivergence or the concept of neurodiversity, which neurodiversity is everybody because everyone's brain is different, versus neurodivergence is people who are outside of that like socially accepted typical range. So I'm not sure which one specifically the rainbow infinity is, but yeah, that so the Autism Assessment Handbook with the gold infinity symbol is the one that I'm thinking of.
If you had to say one,
Mhm.
what would you say is the biggest misconception that people have about autistic people?
It's a lot. I mean, one big one is that we're not able to be competent for ourselves. There's, for example, I think this recently got struck down, but Missouri, when they're doing all these laws around medicine and all these laws around gender affirming care, they wanted to make it so that basically their rationale was an autistic person can't know what their gender is. So an autistic person should not get any type of care around being transgendered, because how do they really know that they're trans?
Yeah.
And that's something that comes up. It's not officially, there's no law that says autistic people can't be parents, but autistic people often lose custody battles on the grounds that they're autistic, I'm not.
Yeah.
I'm the more qualified parent to have our kids, and judges issue orders based on that. We get put in kind of like, and I don't know if Britney Spears is autistic or not, but that type of conservatorship, we're more
Yeah.
likely to be put in that, because it's just, I mean, and I'm not saying every single person should be given full, I'm not saying nobody needs help managing their money. It absolutely happens, but
Sure.
it's an assumption of incompetence. It's an assumption that you can't be trusted to manage your money. And the research around autism being conducted by people not within the community is that assumption. You can't do your own research about it, or you can't be trusted to tell us what your needs are. We need to tell you what your needs are, and then you need to do what we say because we know better than you.
Okay. He has grapes now. He wants to show off that he's eating
Oh,
grapes.
good. Aw, yum.
Okay. Where can people find you? If anybody wants to find what you write, what you have to say about these
Yeah.
topics, where could they find you?
Yeah, so my blog is the main one. It's resiliencymentalhealth.com. I do write a lot specifically for mental health providers, but it honestly it's a lot of whatever's on my mind. They're looking at changing the psychologist licensing exam, and I'm not happy about that. So I wrote about why I'm not happy about that. And then I think next week I've got I spoke with another author, and so it's going to be them talking about the book that they wrote. So I'm kind of whatever comes to mind, and then I usually talk about stuff I'm doing there. I am Dr. Amy Saidi on Twitter and Mastodon and Blue Sky. And then Amy Marschall on LinkedIn. Although my LinkedIn, I'm a little bit, I'm vetting a little bit better because, I mean, I'm glad you found me on LinkedIn. There's a reason I haven't just deleted it, but
Yeah.
90% of LinkedIn is people trying to sell me stuff, and I don't.
Oh
I
my
don't
God,
want anyone to-
yes.
yeah. It's just, oh hey, you know, can you do that? Can you do this? And I'm like, or it's mostly, what did I say? I said it was like 70% people trying to sell me stuff, 25% people wanting me to do things for them for free, and then 5% stuff that's actually helpful. So like this is like, you know, public education. This is like a helpful, but then it's like people who are like, hey, we need a keynote speaker for this conference, and I'm like, oh, what's the pay? And they're like, no, you have to pay us $500. And I'm like, no. You pay me to keynote at your conference, not the other way around.
Yes. Okay. Well, listen, thank you so much
of
for
course.
agreeing to come on. It's been a very good discussion.
Yeah.
Vincenzo, say bye.
Bye.
You have a good day.
For now, this is the Rational Egoist. I'm Michael Leibowitz signing off. Remember, like, share, comment, subscribe. Till next time. Can't get it because I'm lefty. I'm righty,
yes.
actually, and I can't, he's
Oh.
in that end.